Our doors opened in 1874 with a simple goal: to educate students. But there's always been more to it than that. When the world battled its neighbors, McAllister raised the United Nations flag. When others said no, McAllister said yes. When division and discrimination plagued this country, McAllister alumni and students organized and took action.
We are not complacent.
We are not apathetic.
You, out there, have made a difference. In your neighborhood, in your town, in your city, and beyond. So, for all the learners, for all the mentors, for all of us everywhere asking big questions, thank you.
Thank you for not just asking why, but also what's next. Thank you for launching our mission into the world. Thank you for continuing to support that mission. Every day, for every student, whose aim is to lift up, to change, to discover, to reimagine.
To make this a place where we all belong.
A place where education is just the beginning.
It is our practice to begin our programs with a land acknowledgement. We would like to take a moment to honor the fact that McAllister is on Dakota land, and many of us currently occupy the ancestral homelands of the Native peoples who were forcibly exiled from the land because of aggressive and persistent settler colonialism. We make this acknowledgement to honor the peoples of the First Nations, their ancestors and descendants, as well as the land itself. We recognize that this acknowledgement itself is not enough and only serves as a first step towards decolonization.
Hello, everyone, and welcome to this evening's Big Question program. I am Lily Alexander from class of 2014, and I use she and her pronouns. I'm a communications specialist for the Public Health Department of Seattle and King County. And we had the first case of COVID-19 in Washington State in late January, and I've communicated about COVID-19 pretty much every day since then. I run much of our digital communications, including our blog, social media, and different parts of our website. And speaking of digital, there are, of course, some obvious changes in tonight's format. Unfortunately, we're not able to be physically together on campus, but the McAllister community is united here together this evening. And it is great to be in community with all of you. Thank you for joining us. Before we begin, I'd like to share a few technical details with you all. First, have no fear. If you have any questions or technical difficulties, you can chat Mac Help staff directly from the platform, or you can text the phone number 651-204-3910 for assistance to contact our tech support team directly. We've allocated plenty of time this evening, both for questions you may have shared during registration, as well as live questions that you could submit throughout the event using our Q&A box. I'll be sharing who is asking the question, so if you could share your name and the pronunciation, I would greatly appreciate it. And towards the end of the program, we'll use the chat feature to share information and additional links with you, so look out for that. Please be aware that today's program is being recorded and will be available online after the fact on the Big Questions webpage. Finally, after the event, we'll have time for networking and continued conversation. Both President Rivera and Professor Carter will move over to Remo for our virtual networking tables. A link will be shared in the chat and was also included in your confirmation email. We hope you can join us there. A note about the Big Question series, which was launched to celebrate the McAllister Moment campaign for access and excellence. These events have really resonated with both alumni and parents because they really illustrate how wrestling with big questions often leads to those breakthrough McAllister moments, connecting people with one another, to faculty, and to the work of the college. This year, we are thrilled to have McAllister Professor Suzanne Rivera leading the Big Questions conversations. As we continue to welcome her to McAllister, we appreciate her leadership, especially now as we navigate everything happening in the world around us. She is excited to continue to meet alumni and parents around the globe online until we can connect in person again. We are pleased to be able to continue this series and convene tonight to answer the big question: will anything be the same after COVID? We see news about how the US and countries around the world are responding to COVID-19 changing every day. And now, as we hear news about vaccines, we're looking to what are some of the unique and long-term impacts of this pandemic, whether it be on economics, education, science, hunger, civil liberties, and what lessons might we learn from other countries? These are critical and difficult issues. We are fortunate that President Rivera will bring her bioethicist lens to the discussion as our host tonight. Joining her in conversation are Macalester Eden's Associate Professor of Geography and Global Health, Eric Carter. Professor Carter was my advisor and mentor at Macalester as a geography major and helped spark my interest in public health in Latin America. I am excited to share discussion space with him again, as I once did in his classes. Also joining us tonight is Dr. James Ochi, class of 1980. He is an ear, nose, and throat specialist, as well as a 2020 Alumni Award recipient. This will surely be a great conversation. And with that, President Rivera, I'll turn the program over to you.
Thank you so much, Lily. Thanks for being with us tonight. And welcome and good evening to everyone participating in this event, those who are here on campus and also those who are tuning in from around the globe. I am so honored to have this opportunity to host what I think will be an extremely timely and relevant conversation with Professor Carter and Dr. Ochi. And let me just take a moment to congratulate Dr. Ochi on his recent Macalester Distinguished Citizen Award. We are very proud of you, Dr. Ochi. So I think without delay, we'll jump into answering our big question here, leading to what I hope will be a very thought-provoking conversation. And I'm going to start with you, Professor Carter. I want to know, from your perspective, given everything we know from previous global pandemics, like the influenza pandemic of 1918, how can those events and what we know about them inform our thinking about the challenges we're facing now? What did we learn from those that should shape the way we're viewing the moment we're living through?
Yeah, that's such a tough question. First of all, thanks for having me here. This is an amazing opportunity, and it's so great to see Lily and to also be here with Dr. Ochi, even if we can't all be together. Yeah, I am a geographer, but I do a lot of historical research. I've done a lot of historical research into past epidemics. And it's really interesting to look back at the 1918-19 influenza pandemic. I mean, one of the things that's really noteworthy about it is not just how monumental it was in terms of its mortality and its global impact, but also how quickly it was forgotten. And I mean, I think that it wasn't completely forgotten, but historians didn't study it for a very long time until the 1970s. It wasn't in the history textbooks, partially because it came right after World War I. And so it was sort of this historical void for a very long time. I have a feeling that we're not going to have that same exact problem with COVID-19 because it's just been such a totalizing experience, long-lasting. There's been billions and billions of words written about it, and we're just fully embedded in it. We're not going to soon forget. I think after 1918 and 19, things quickly got back to normal, and people wanted it to be that way. But I think things are actually going to change pretty dramatically in the world after COVID-19 in a few significant ways. I think the way that I look at this is that there are already a lot of structural, political, and economic changes that were underway for a long time now that the COVID pandemic has just accelerated. In particular, conflicts between different sectors in terms of their labor conditions and sort of workforce conditions. And what I'm getting at is that there had already been a big trend towards automation and digitalization of many jobs. And we've seen how during this pandemic, many of us have been able to adapt really quickly, work from home, work from a distance. Those of us who are white-collar professionals in the knowledge economy, but not everybody is having that same experience. And so I think that this the end of the pandemic is not going to resolve these social divides, but possibly exacerbate them, and it's going to be a big political problem for years to come, not just in the US, but in other parts of the world.
Yeah, and do you attribute to the different way that we're facing this pandemic to changes in technology and society, or do you think there's something unique about the moment we're living in, or do you think that if we didn't have, for example, access to computers or access to the healthcare that we have now, would we face the pandemic in the same way?
Yeah, I've been thinking about this a lot, and I don't know if I have the answer. I mean, this is such a big question, but this is the way I've been thinking about it, is that if this pandemic had happened, let's not say 100 years ago, maybe that's too far back in time, but let's say 25 years ago, which is around 1995, and I kind of mark that as the beginning of when the internet became more widely used. I think we would not have been able to handle it. I mean, people wouldn't have been able to stay home from white-collar professionals, knowledge economy people. They wouldn't have been able to stay home from work. Kids wouldn't have been able to stay home from school. We would have had to confront this pandemic much like we had historically. I mean, it would have been much more catastrophic because people would have not had the same ability to social distance without the economy completely collapsing. I just can't picture it, and that's only 25 years ago within our lifetimes. So I think that is something that is different about this moment. In a way, we're kind of almost pre-adapted to handle it differently. At least, again, some people
yeah.
in this society, and thinking about it on a global scale, this doesn't include everybody, but certainly it's made it easier to handle for a lot of people, I would think.
Yeah. This is an important point. I'm going to bring Dr. Ochi into this conversation and ask, Dr. Ochi, as a physician, when you think about pandemic-related challenges you're seeing in the healthcare setting, are there aspects that you think lay people might not appreciate or be thinking about in terms of how this current moment is changing the way you practice, for example?
Oh, I think that's a great question. And again, thank you so much for inviting me to be part of this conversation. I really appreciate it. I would say that one of the things I have thought over the recent months is the saying, wherever there is change, there is opportunity. And for me, I've always thought of the goals of my practice as being to provide timely, efficient, and cost-effective care to the children that I'm trusted with. And, you know, our healthcare system, as all of us know, is way too expensive and way too inefficient. And one of the issues with that is if you, as an individual doctor, try to come up with ways to innovate and save patients and yourself time and money, and if there's any snafus, you know, you're going to be in big trouble. But because the pandemic suddenly thrust all of us into a situation where we had to cope quickly and cost effectively with the changes that have been thrust upon us, it has given at least me some opportunities to help make things better for patients. And with regard to that, a specific example would be, you know, the typical scenario in my practice is a parent brings their child to see me, and we go through the history and physical, and if surgery is deemed to be necessary, then the next time we see each other, we'll be at the hospital and we do the surgery. And then, of course, the patient comes for a post-operative visit so that we can talk about any issues that they might still be facing and, you know, tie them up. Well, that's obviously a minimum of three visits, 3 encounters with the doctor, 3 co-pays, 3 times a child has to be taken out of school, 3 times the adult likely has to be away from work. And this can add up very quickly. Well, because of the pandemic, what it has forced all of us to see is that simply going to the doctor does entail risk. And so one of the things that has happened, as all of us know, is that medicine has shifted to a televisit platform in many areas. So for me, the scenario that it now involves many times is I talk with the parent over the phone, and we go through all of the historical details that we would normally. Very often in my practice, once you do that, you can quickly realize that the child needs this or that procedure or a combination of procedures. Obviously, that doesn't make it completely definitive because you haven't had the opportunity to examine the child. But typically what I do now is I arrange, if the parent is agreeable, which they almost always are, for the next visit, which is the first visit that will actually lay eyes on each other, is at the hospital right before surgery. And obviously in the pre-op area, then I'm able to actually sit down with the parent briefly and the child, examine the child. And then if things look like they still need to go forward, then we do the surgery. And then what I instruct the parents to think about in the days that follow the surgery is if everything is going fine and they don't have any issues that remain, then they can defer the post-operative visit. So what that really boils down to is instead of 3 encounters, 3 co-pays, 3 times the child is taken out of school and 3 times the parent has to miss work, you boil it down to 1. And I would have to say that the parents have been uniformly excited about this. And I've had plenty of parents say to me, I hope you keep this type of style of practice up after the pandemic is over with. So even though this pandemic has brought around great financial hardship and tragedy, there have been times or areas where we've been able to innovate and hopefully move things forward, because the idea of telemedicine has been shifted forward by probably 5 or 10 years. I'm sorry for the long-winded answer.
No, it's a great answer, and it makes me wonder how many of these innovations are likely to stick with us. I mean, Professor Carter, you talked about people pivoting to learning from home, students learning from home. You're talking, Dr. Ochi, about changing the way we do patient visits. So both healthcare and education as sectors were ripe for reinvention and resisted it until necessity required it. So I'm wondering how many of these silver linings that we've created for ourselves out of this pandemic are likely to stick around. Do you imagine some of these adjustments that were made out of necessity for the moment are likely to become part of our new normal going forward after vaccines are available?
Well, I could speak to a little bit in the education field. I mean, so I was teaching at I've been teaching at Macalester for a long time, but I was teaching when the pandemic happened. I kind of marked that as March, when it really impacted our campus right around spring break, when we decided to close. And we made a very rapid pivot, like you said, to all online education at that point. And then in this last semester, many of us had a hybrid style where there was some in-person instruction and then a lot of online instruction. And to be honest, there's a lot of aspects of these online tools that I actually like quite a bit. For example, Zoom meetings can get tiresome, and maybe we've all been spending too much time on Zoom, but they can be a pretty useful way to run certain kinds of meetings with students that might be difficult. Let's say difficult to arrange office hours with a group of 3 or 4 students working on a group project. It actually is pretty easy to do in Zoom, and that's a good platform for it. And then there's a lot of other sort of digital technologies kind of built around Zoom and Moodle, and you can name VoiceThread, all these different things, that they do seem really, really useful. I guess I'm interested to see what happens after we're able to come back into the classroom, and how much we want to go back to some of our old habits and our old ways, and how well we can integrate these technologies into a post-pandemic world. I feel that the classroom experience of actually being in the same physical space with students is something that's really invaluable. And some of my best memories of undergraduate years and graduate school is being in a seminar room with a really great professor, somebody who's really charismatic and knows a lot about the subject, and we can see each other in that room and share that space and see the whole person there in front of us. And I think that that's something that's irreplaceable, and we're all really, I think most of us are really hopeful that we'll be able to return to those in-person experiences, because those are just irreplaceable.
And what about you, Dr. Ochi? Do you see some of the changes we're making in healthcare delivery sticking around after the pandemic is over? Or do you think that people will fall into old habits and expect to do things the old way?
Well, I believe that patients are demanding increased efficiency and cost effectiveness. And the response I've had from the parents of the patients I take care of has been uniformly positive. And a number of them have asked me specifically if we would continue this practice after the pandemic is over, because they view this as being just a much preferable way to practice and take care of their child.
So I wonder what we can do to keep that momentum going, that innovative spirit. Even when necessity doesn't require it, will there be a way for us to continue thinking about improving the things that we do rather than falling back on habits? I want to turn the conversation a little bit to the question of expertise. Professor Carter, you alluded to the importance of being around a professor who's expert in something and can share their knowledge. And similarly, patients come to Dr. Ochi so that he can use his expertise to help. I've been thinking a lot lately about how we all are faced with all sorts of bioethical dilemmas right now. And so everyone is sort of trying to read studies, follow the news, try to do risk-benefit analyses for themselves, people who maybe were not accustomed to thinking in that kind of way. And it makes me wonder about the role of expertise in helping us navigate all these decisions. Should I wear a mask? Should I go visit grandma for Thanksgiving? Should I get a haircut? And so I wonder whether either of you think that our experience with the pandemic is changing fundamentally the way people think about engaging with expert advice. Or maybe it's not, maybe people just stick to their beliefs and are not really changeable. But it's something I've been thinking about a lot, and I'm curious what your thoughts are on that.
Yeah, I don't know if Dr. Ochi, if you want to take that one first.
Well, I think that our society is so individualistic, and because we're used to basically doing whatever the heck we want in general, it has made things very difficult for us as a society to move forward in a uniform way to beat this virus. Mm-hmm. And I just think that with regard to the role of expertise, there has been some diminution, I think, on the part of the public in general of science and objectivity and objective evidence. And I think that this pandemic, to me, is showing us that you can have a difference of opinion, but the facts are the facts. And we need to come to an agreement that we all need to do certain things for the benefit of all of us. And I think that's what we're gradually realizing. It makes me think of what Winston Churchill said, which is the Americans can be depended upon to do the right thing after they have tried everything else.
You want to add anything to that?
Yeah, I mean, I would largely agree. I mean, I've been thinking about this pandemic as revealing a lot of the contradictions and kind of the malaise as well of liberal democracy and late capitalism. And, the truth is that people at this stage of world history in a country like the United States, they really, as Dr. Ochi says, they mostly do what they want to do. They resist the council of experts. I mean, that's what the history of liberalism is really about in so many ways. It's like, it's moving towards egalitarianism, freedom from from the church,
dogma,
freedom from tradition,
yeah.
freedom from dogma. Mm-hmm. And now it's just sort of, in a sense, inevitable that it would evolve in this way. There will also be a desire to be free of all authority, and also, essentially be free of being told what to do. And I think coupled with that, there's a real decline in trust in government institutions. I think this could be traced back historically to, the 1950s and 1960s, but there's also active agents in our society who are pushing to undermine trust in science. I mean, I think that's really important to recognize. It's not just a natural process of erosion and that people just gradually grow more skeptical about science. Those seeds have been planted repeatedly. It started with big tobacco, and then with companies who lined up against climate change science, and they've been planting seeds of doubt in the public conversation about what experts can bring to the table. And so it's not surprising to see a lot of conspiracy theories and distrust. It follows the same pattern as we've seen before, but now with the COVID pandemic when so many lives are on the line. So I think it's important to recognize that there are there are people who are sowing mistrust in our society. And actually, that's a good thing to recognize because it means possibly there's some things that we can do about it.
Well, that makes me think back to what you were saying about how the pandemic has sort of been shining a light on inequalities in our society, maybe even inequalities that have taken on new residence for folks who previously ignored them or were not fully aware of them and now can't really escape thinking about them. I wonder how you think that new awareness of social inequalities that now seem more front and center are going to change our behavior going forward. Do you imagine a permanent shift? Will we be able to go back to not seeing all the things that are unfair and unequal, or is that impossible?
Well, I want to be optimistic. And so hopefully the answer is yes, that we can change and we'll continue to see these social inequalities and try to do something to create a more egalitarian society. Part of me is the main part of me is more pessimistic, is more pessimistic about this. And I think that part of the reason is actually that maybe you and I and many others recognize all the social inequalities that are exposed during the pandemic. For example, health inequalities based on race and class. And just higher risk of, higher vulnerability to becoming infected and dying from COVID-19. But I think that despite the fact that the pandemic is global in scope and it's a totalizing experience and it's universal, I think most people are really tending to personalize this experience. And so they're actually looking at the pandemic, I think for the most part, they're feeling very put upon. They're feeling, at a minimum, inconvenienced, but sometimes really severely limited by what's happening during this pandemic. And so they don't feel a lot of empathy necessarily with people who are also going through the same thing that everybody else is going through. So in that way, I feel like it might not actually lead to that kind of empathy that's necessary to overcome these big social divides, unfortunately.
Well, that comes back to what Dr. Ochi was saying about our sort of individualistic culture. We don't have a spirit of approaching problems from a communitarian perspective and thinking about the common good. And in some ways it has been a strength in our country that there's that sort of rugged individualistic spirit, and we celebrate individuality in many ways. But when it comes to voluntarily giving up individual liberties because it's beneficial to other people, that has not been a tradition here. And we see in other countries that in some ways are doing better than we are with bending the curve. In large part, it's because they have a more communitarian approach to public health and just group well-being in general. It makes me wonder what we can do in our own culture, in our own society, to get people to think in a way, to think differently. Going forward, is it possible for us to inculcate our children, for example, with values that are focused more on the good of the whole than on individual achievement? You work with kids, Dr. Ochi. What do you think about that?
Well, I do hope that these changes in discussions we're having in our society do have a permanent effect, because it's sorely needed, obviously. And I was thinking to myself that the last time that we as Americans have really needed to do anything for the good of everybody has probably been World War II. And obviously that was a long time ago. So
I think
hopefully this will stimulate permanent change. Yeah. Go ahead.
Sorry. I think that there is evidence of a communitarian ethos that exists in some parts of U.S. society. We're not totally libertarian and totally individualistic, although that's a strong tendency of our culture. I just feel like community gets built at a different scale than at the scale of the entire nation. I mean, this is a very large, vast, diverse country, and so maybe one way forward is thinking more about community building more at the local scale, like here in the Twin Cities.
Or even our campus, I think, is a great example. Every time I look around at the campus, what I see is people taking really seriously our community commitment to protect one another. And what started out as a slogan over the summer when we were trying to think about how to communicate the expectations for being on campus, what I observe is that people have really internalized that. Even when outdoors, I usually see students wearing masks and staying far apart, and we have reimagined every part of what we do on this campus in order to do it in a safer way. And I find that really inspiring, but that is a scale issue, right? We can control what happens on our campus. We can't control what happens in the Twin Cities.
Yeah, and also that outcome that you're talking about, I agree with you that we've had this great community spirit and people have really been following the rules about, wearing masks and social distancing. To put all that together, it took a lot of work and planning and very careful messaging and a lot of thought and really great leadership. And so that's also something it's a missing piece. You do need somebody to orchestrate these efforts, and so great leaders can produce these sorts of results. And leadership is lacking right now politically in this society.
What will it take at a national level when we think about, for example, vaccine distribution? What do we need in the way of national leadership in order to move forward? Dr. Ochi, I imagine you're already thinking about how it would work to distribute vaccines in a pediatric practice.
Well, I think just in general, just in our society, this is going to be an unbelievably huge, logistically complicated effort. And I just, I just hope and pray that things go off relatively well, because there are going to be hiccups, to be sure. But this is such a critical time period for all of us. And they need, the federal government needs to do whatever they can to, provide the leadership so that the vast majority of Americans do end up getting vaccinated. Because obviously it's one thing to have it in your neighborhood. It's another thing to go down there and roll up your sleeve. And, as we all know, surveys have shown that up to 45% of Americans have said that if they were offered the vaccine, they would not take it right now.
Boy, that's dispiriting. I wonder, who do we think ought to decide, and how should we decide how these vaccines get distributed? It seems like a big, gnarly problem.
Well, there's already a little bit of discussion about this today. The CDC came up with some guidelines, and I don't have all the details because it just happened today, but I know that they're making, frontline health workers the first in line, which makes complete sense. And I think some at-risk groups, are going to be, further up in line. I have a lot of optimism for some reason about the vaccine program, because I remember 2009 when we had the H1N1 epidemic, which thankfully turned out to be not quite as bad as we might have thought at that time. But I remember standing in line when I lived in Grinnell, Iowa, standing out in line outside the community center with my daughter, who was then 1 or 2 years old, to get the vaccine. And actually it went really smoothly. I know that there was a lot of work that went into it, and thousands and thousands of people were involved. But I think we have models for vaccine distribution programs that have worked really well in the past. I think if it's clear that I think the public health communication has to be really good, and maybe this is where Lily could say something about it later, but it has to be really clear that these are safe and effective vaccines. They have to be universally accessible and free. There have to be no strings attached, in other words. And I think that people will gain confidence in the system. And I think a lot of people are resistant right now, but I feel like that resistance to vaccination is going to erode a little bit once they start to see it happen. And do you think, Dr. Ochi, that we're going to be in a situation where we're going to have to create incentives, such as paying people to take the vaccine? Is that a possibility?
I've not heard that, and I certainly hope that isn't something that our government is going to have to shell out money for. Because, I just hope that we end up getting the kind of leadership that will convince the vast majority of us to do the right thing, because this virus is not going to go away. In other words, even if the vaccine is distributed widely, it seems to me that we're going to have some level of COVID for the foreseeable future. Mm-hmm.
So I know that we're getting close to Q&A time. I want to ask one more question, and that is, when we think about all the things that we've learned living through this pandemic, heaven forbid we were to get struck with another major virus or some other major disruptive world event in 5 years. What would be something important that we've learned in this period living through the COVID-19 pandemic that you feel like would be helpful to us? If we had a major challenge to infrastructure or a major disruption, what have we learned at this time that's going to better prepare us the next time we have a challenge like this?
Well, I'll just say that I think we've learned how quickly we can adapt to new situations. I mean, I could not have dreamed back in January or February that we would be living the way we do now, and that things would have shifted so dramatically, and we would have gotten used to, for example, wearing masks, which I had never done before in my life outside in public. So I think that's encouraging. We know we can do it, right? And maybe steps would have been taken earlier if there had been more confidence in knowing that we could make the necessary changes. So that gives me some optimism. I'm a little worried though. I think the next pandemic, when one happens, it's quite likely it could be worse, like sort of a worse virus, more deadly. I mean, this has been a very serious pandemic, but it could be much worse than this. So I think we need to continue to be on guard.
How about you, Dr. Ochi? Anything that we've learned right now that could be helpful the next time we have a crisis?
Well, I think for me, I remember when I was in medical school up to 40 years ago, I remember our professors telling us that public health was severely underfunded. And certainly that trend has continued all the way up through the present time. So if nothing else, I think we will have learned as a country that it is important to invest the proper amount of financial support to public health so we don't get into this situation again.
Well, I hate to cut this great conversation short, but I know that we want to leave time for the audience's questions. So first, I want to just thank you, Professor Carter and Dr. Ochi. Your insights have been invaluable. And I know even though there's been an enormous amount of grief and loss with this pandemic, I feel like you have given us cause for optimism tonight. I feel better having heard what you have to say about where things are going. And it also gives me hope about the ways that Macalester can make a contribution. When I think about what we're preparing our students to do, to go become global leaders, to make a more just and peaceful world, I feel like conversations like this clarify the ways that we can make a difference. And having Lily on the call tonight, or as a moderator, is a perfect example of that. So thank you so much for inspiring all of us. We're now going to move into the Q&A portion of the event for the next few minutes, and we've been tracking your questions as they've been coming in, but you also can continue to add questions through the Q&A tab feature. So now I want to welcome back Lily Alexander, class of 2014, so that she can moderate the Q&A portion of the evening. Lily, are you ready?
Yes.
Great.
Thank you. So we got a ton of questions, as you all might imagine. The first question that I want to bring to all three of you is around travel. And Eric Etjen from the class of 1982 asked, in what ways will travel look different following the pandemic? And I want to tack on one other small thing. Mary Burns from class of 2004 said, has COVID weakened the strength of a US passport permanently? So in what ways will travel look different following the pandemic? And what implications does COVID have for the strength of the US passport?
Yeah, I guess I'll start. I'll start with the second question. The U.S. passport has definitely been devalued recently, just because so many countries are limiting our entry to them because we've had such a severe pandemic. I don't know if that'll be permanent. I get the feeling, and this is my sense of it now. So travel has been obviously severely curtailed by the COVID-19 pandemic. I know that the airlines have taken lots of steps, or all the steps that they can, to ensure safety aboard flights. For example, having an empty middle seat between two people and making sure people wear masks, and maybe improving ventilation systems. I'm not totally sure about that. But I just don't see how, in the long term, they could continue to do that. I mean, they're not going to continue to practice those safety practices aboard the plane once COVID-19 numbers are down to a reasonable level, and I think people will quickly become accustomed to traveling again. I know from speaking for myself, I'm a frequent traveler. I spend a lot of time in Latin America doing research, and I am just dying to be able to go back and see people that I know and to be out in the field and to experiencing other places than St. Paul, Minnesota.
Than my living room?
Than my living room, right. And so I really feel like there's going to be a sort of a huge reaction. It might take a couple of years, but I forecast, I'm not a fortune teller, but I think in a couple of years, those travel numbers, the volume of international travel is going to be about where it was before the pandemic.
My reaction to the question, though, is a little bit different. I'm thinking less about the mechanics of travel and more about the demand for travel. So I think one thing that's permanently changed is that we're reimagining what workplace means. So much of travel before was required for work. And even in the way that we operate the college, it's no longer necessary to fly in a speaker to give a talk in person. We're transforming the way we do so many things that even the idea of reporting to an office every day for some jobs may go away. And if that's true, then some of the routine travel that people used to do all the time without thinking about whether it was really necessary to get on a plane may stay in a virtual space and reduce business travel in ways that are hard for us to foresee or, hard to predict.
Yeah, that's a good point. I guess probably business travel will continue to diminish, but then maybe more travel for pleasure and family could be a possibility. I know what you mean about the speakers. We've tried to have speaker series, using Zoom here on campus because we can't fly in speakers. It's not the same.
Yeah.
It's really not the same. A part of it is the divided attention. I'm sure there's 300 or 400 people watching this right now on their home computers, and I'm just assuming like many of you are doing other things right now. You're not, you're not 100% focused on this conversation, because I know that happens when I'm in Zoom meetings, especially committee meetings on campus. And so to be able to bring people into the same space and have that focused attention on that speaker and to really engage them, I think people will be craving that again. It's something that I think we really enjoy, at least in the college experience, yeah.
Well, I'll just say the silver lining of this is that we can reach out to 300 people for this Big Questions event virtually in a way that we used to be limited by geography. So there's another side of the coin, too. We're going to have to figure out what the new approaches are that make sense. Dr. Ochi, do you want to add anything to that question?
Well, I was going to say that to me, it appears that the real risk when one travels is not necessarily sitting in the airplane, but it has to do with going through security beforehand and then lining up to get on the plane and, lining up to get off the plane. Those appear to be the most risky times for people traveling. And I don't know how we're going to modify that in a way that makes sense and is time efficient to screen everybody before they get on and then to convince people that everybody doesn't have to stand up immediately when the plane lands. So it's going to be difficult,
Do you have another question, Lily?
Yeah. So bringing the big question kind of to McAllister is kind of what will McAllister look like after COVID? And we have a couple, maybe many current students on tonight. And one specifically, Aliyah Mahmood from class of 2021 asks, what kinds of conversations and decisions are being made about next semester around the vaccine? And can you expand on what cases have looked like these first two modules and what this could mean for this next year as well?
Well, I can tell you that I just had a Zoom call a Zoom meeting with presidents of other liberal arts colleges here in the Twin Cities to begin to talk about how we might cooperate if and when the Minnesota Department of Health makes a batch of vaccines available for colleges and universities. We hear on the wind that congregant living situations, including higher education, are likely to be among maybe the second or third waves of groups that will get access to a vaccine. I think Professor Carter's right, healthcare workers are going to be in the first wave. Vulnerable groups like elders living in nursing homes are very likely to be in the first wave. And I think if there's a second wave or a 1B, it might be first responders and sort of essential workers, But after that, educators and students are likely to be next. It's a huge group, and we know that the economy can't get back on its feet until students can get back in school. So we think it's likely that we'll be, in maybe that second or third wave. And when that happens, the good news is we're going to be really well equipped to distribute vaccine. We're already practicing it. We already distributed influenza vaccine this year on campus very efficiently. Students who are here on campus know that we've been testing 300 members of our community for COVID every week all fall, and we've got that choreography down to a well-oiled machine. So I think when it's available, we will get in line as quickly as we can, and we will stand up a system for distributing vaccine not only to students but also to faculty and staff just as soon as we can. Nobody wants to get back to a regular full campus more than I do. I'm looking forward to that.
Building on the ethical dilemmas around vaccines, I thought this question was very thought-provoking from Carol Runyon from class of 1972. And Carol says, once available, should vaccine for COVID be mandatory, as it is in some sectors for influenza? And what are the ethical arguments as you see them?
I have an opinion.
Well, I feel like, Sue, with your background in bioethics, I really want to hear your take on it.
Well, personally, I err on the side of reducing liberties when it comes to vaccines because I am someone who thinks that the greater good is achieved by virtually everyone who can get vaccinated to be vaccinated. And of course, this is a source of some controversy in the United States where lots of people, even now, I'm not talking about COVID, I'm talking about parents choosing not to vaccinate their children for lethal diseases that have created all sorts of challenges in schools and in communities. There is some portion of every community that cannot get vaccinated for one reason or another. Let's say that they have, an immune deficiency or they're getting treated for cancer or something like that. If the rest of us don't get vaccinated, we unfairly put the burden on those folks because they're the ones who are most at risk. So I'll tell you this right now, I'm going to be the first one in line to volunteer to get a vaccine, even if others are afraid to get it. And I actually think that we have a moral obligation to get ourselves vaccinated when it's available. As a matter of policy, the college already requires certain vaccines because that's the safest way for us to all live together. And it's hard for me to imagine that when a COVID vaccine is available, that it wouldn't be a requirement unless someone had a valid medical excuse. What's your reaction to that, Professor Carter?
No, I agree with your reasoning. I mean, I've studied this issue of vaccine hesitancy a little bit, not so much from the ethical perspective, but just trying to understand culturally, like where did this come from, and what kinds of sort of divides in our society. I guess this is sort of a theme for me, but what sort of divides in our society are exposed by these different attitudes about vaccines? And one thing I found is that the vaccine skepticism is usually really high among people who have never had experience of these kinds of infectious diseases that the vaccines are supposed to be used against, and so this is sort of it's a paradox of immunization, right? I mean, there's very low risk for some of these diseases because so many people are immunized, and then people tend to look at the vaccines themselves as being relatively high risk because they don't think about the mumps or rubella because people are vaccinated. So maybe things will be different this time because we've all been experiencing COVID, but I agree with you too. I think as a matter of public policy, unless people can show some sort of a medical exemption or some sort of a religious exemption, I think it should be these vaccinations should be required. That's the way it works in many countries. Mm-hmm. I wish it were so here. I know it's a tough sell in a lot of ways.
I'm guessing this is something that Dr. Ochi sees quite a bit in his practice because this is where the controversy sometimes is revealed, is when parents want to resist childhood vaccinations, right?
That's exactly right. I've actually had some parents already ask me if I were going to take a coronavirus vaccine if it were made available. And I tell them, if my appointment is at 3:00 in the morning, I will show up early with my sleeve rolled up. Mm-hmm. And I've had those same parents say to me, well, what about the long-term risks of that kind of vaccine? And I've said to them, there are over 263,000 Americans that are dead from this disease. There might be some element of long-term risk, but for me, I'm willing to take that risk because against that type of mortality, you know, I'm willing to put up with a little bit of a risk of long-term side effects. And, you know, it's amazing to me that I have to say that kind of thing, but, you know, I have already found myself in that kind of conversation from time to time.
Well, I'll see you there at 3 a.m. in the line.
Yes.
Lily, do we have a few more questions?
Yeah. So I kind of have a spatial geography question for you, Dr. Carter, and for anyone else that would like to partake. So, you know, we talked a little bit about just obviously the transition for a lot of folks in white collar roles to more remote work. And I thought this community member, Warren Safa, had this really interesting question about how permanent these changes are going to be and that how they might affect our choices around where we choose to live. And I know for myself, I am currently on the East Coast, even though I'm working for the Department of Health in Seattle, and, you know, just thinking about the density of cities and the cost of certain cities. I'm kind of curious from a spatial perspective, Professor Carter, how you think that some of the transition to more remote work might affect our choices about where we choose to live.
Yeah, so I think again, if we're talking just about U.S. society, it's a certain segment of society. I guess you could maybe say the top 10%, just to give you a number, who can make these kinds of choices and who could just dream of just moving out of the city they live in now, because they'll still be able to essentially telecommute to work. They'll be able to do all their work remotely. And actually, this is already a really big trend. I mean, I've been reading about, you know, in the areas surrounding New York, like real estate values skyrocketed back in the spring and the summer because so many people are moving out of New York City, partially because of fears of the pandemic when it was in full swing, but it was also just because they were like, I can work from whatever upstate New York and live in a nicer place for me, and I don't have to be in the city anymore. I've also seen that students have done this too. So actually, we have a lot of students right now who are they're all over the place. And, you know, and some of them are actually living at home with their families. That's probably the most typical arrangement for students who aren't here in the Twin Cities. But some of them have just decided to get apartments or homes together in some far off place that they've always wanted to be in. And to be honest, like a few months ago, I was thinking, gosh, if we're going to do distance learning for a really long time, I'm just going to move back to California, where I'm from, and be with my people in Los Angeles. If it makes no difference. But I think this could be a really long-term trend, and actually this could exacerbate, again, these sorts of social inequalities that we see so severely in places that are these sort of attractive, exurban towns, in rural areas, places like, Wyoming and Idaho, where there are already a lot of conflicts between people who have lived there for a really long time, maybe living off the land in extractive industries or ranching and farming and what have you, versus newcomers, who bring a lot of money with them from New York or Los Angeles or San Francisco. And I think that this pandemic is accelerating that kind of trend. Yeah, for sure.
If I could add to that, what I would say as a physician, now that I'm 62, I have friends who are moving to places like Hawaii and, say, to Nevada, out of California to retire. And with regard to Nevada, specifically to avoid paying income taxes, which is understandable, and I can completely agree with that. One of the things that some of my friends have not taken into account, though, is if they move to a smaller town in Nevada or even Las Vegas, and they have health conditions that require specialist expertise, they find themselves in a situation where there are not enough specialists to take care of the conditions that they have. And so then they have to drive back hundreds of miles to see their specialist here in San Diego. And see, with regard to something like a pandemic, in my view, you have to think about the availability of ICU beds and, You have to think about the logistics of getting to a major medical center and other things like that. So it's not just, in my opinion, where do you want to live? Where is the scenery the nicest? Especially for an older person like myself, you have to think about the availability and accessibility of specialist, high-level specialty healthcare. Because if you're going down the tubes of COVID, you might have a matter of half an hour or a few hours to be seen and to possibly get intubated or else, you know.
You mentioning taxes also makes me think that one thing that'll have to catch up to this kind of massive telecommuting behavior is the way that we handle income taxes. There are people who live in one municipality or one state and work in another one, and they're having to deal with double tax or, you know, different tax rates. And that seems like a system that is based on the old way of thinking that you have to live exactly where you work. And if that is permanently transformed, then the tax codes will have to get transformed too. It doesn't seem sustainable.
Yeah, and I guess it could lead to situations maybe like Dr. Ochi is describing, people living in, they're earning California money, but living in Las Vegas where they don't have to pay state taxes, and
Right.
that doesn't seem fair either. So I guess there could be sort of like tax havens, essentially, if people are able to telecommute and live somewhere where the taxes are lower.
Yeah.
Sweet, sweet California money. I have one last question, and then I'm going to turn it back over to you, President Rivera. So alongside COVID-19, as we all know, this year has really brought a national reckoning with the systemic racism in our country. And I know that in Seattle and King County, where I'm based, we declared racism to be a public health crisis in June, and they were very real and tangible commitments that were made to policy and budget to go toward this crisis. And so I'm curious, for any of the three of you, what kinds of long-term impacts you think the COVID pandemic will have on racism in this country, if at all?
Who wants to start?
Just an easy one, you know. Just...
I guess I'll jump in and say that racism was a public health emergency long before the pandemic. We know that social determinants of health, and of course it's true that race and class are conflated in a really sinister way in this country, but social determinants of health largely make it so that the zip code you're born in can tell a lot about when you will die, how far you will go in school, whether you will be incarcerated, whether you're likely to lose an infant in a baby in the first year of their life. And so in some ways, the whole construction of the problem, the way we're looking at it now, as though the pandemic, that racism is a crisis now. It was a crisis before. Maybe more people are paying attention to it as a healthcare emergency now than did before. And of course, COVID-19 specifically has leveled very cruel consequences in our most vulnerable communities, so it's impossible for us to look away. What I hope will happen is that we will be thinking much more critically about the way we allocate resources, such that some of those social determinants that are circumstances that we can change simply by making decisions differently, by budgeting differently, for example, thinking about budgets as moral documents that really say what our priorities are, can lead to large changes. I'm really inspired. I'll tell you a really quick anecdote. The mayor of St. Paul, Mayor Carter, told me a story recently about a new program he's created here where every baby in St. Paul gets $50 deposited into a college savings account. It's not a lot of money for the city to invest, but he started that program because he read, it's been shown empirically that if a kid has a college account, even if the money in it is small, they're 3 times more likely to go to college. And it's also been shown that if the parents deposit more money into that, even modest amounts like $100 or $200, by the time that kid goes to college, they're 4 times more likely to finish. I find that really inspiring. Mm-hmm. It's a lot cheaper than incarceration or many other things that we spend money on that don't do the things we want them to do. And so I hope that the kind of creativity and innovation that has been sparked, for example, in healthcare and higher education, we can also apply to thinking more imaginatively about the way we organize ourselves in society, and how we can lift up communities that have been excluded, that have been marginalized, that have been made vulnerable.
Mm-hmm. Yeah, and I just think that greater investments in public health, more targeted investments in certain neighborhoods would make a huge difference. And also just continuing to do that work of trying to improve our healthcare system so that there's more universal and equitable access to necessary resources would make such a huge difference.
Do you want to weigh in on this one, Dr. Ochi?
I echo everything that you folks have said. I think that it's such a huge challenge because many times the marginalized communities are located very far away in areas where it's just going to be very difficult for those people to show up and get taken care of properly. And, and they don't have the kind of access to reasonably good, healthy food because they don't have grocery stores in their neighborhoods and that kind of thing. It's so difficult. And I see that, and I have seen that throughout my career. But I hope we can move forward with these kinds of issues, definitely.
Well, I think it's my prerogative to ask the last question now as we wrap up. So I'm going to say, I want us to end on a high note. Professor Carter and Dr. Ochi, we all know this pandemic has turned the world upside down, and the number of deaths has been heartbreaking, the amount of grief that we're all holding, the economic devastation, and as we have just said, the stark reality that the consequences have not landed in an equitable way in our society. So can you help us leave with a sense of optimism when you think about all the things we've been through in the last 10 months? What is giving you hope right now? What encourages you to think we can build a better new normal?
Well, if we're going to end on a sort of personal note, I'll just say that I have been confined a lot of the time at home with my children, and I've actually found that I've gotten to participate a lot more in my children's development. I get to watch them learn, right? It's a nice way of saying that they haven't gone to school in 10 months or whatever it's been. But I guess I've just been way more attentive to their different learning styles, how sort of different strategies work with one of my daughters but not the other. And so I guess the upshot for me is that every new situation is a opportunity for learning, right? And even though there's been a lot of negativity, a lot of really sad times that have been, that have come out of the pandemic, the time I've been spending with my family has really helped to build me up.
That's great. How about you, Dr. Ochi?
I would have to say that this past Thanksgiving was very difficult for my wife and I because it was the first time that we celebrated Thanksgiving, just the two of us. Instead of having our children with us and others, and it was very difficult. But I guess the message of hope that I would have is that for there to be 3 vaccines on the horizon that have around 95% efficacy, that is unbelievably huge. That basically matches the best vaccines that we have, period. So it just seems to me that although the Christmas holidays may be as difficult as Thanksgiving, if not worse, potentially, it appears that hope is just around the corner. If we can hang on just a little bit longer, if we can work together in doing all the things that we know that are good for all of us, it appears that relief is just about on the horizon in front of us. And what a wonderful thing that is.
I agree, that is really encouraging. Well, thank you again, Professor Carter and Dr. Ochi, and thanks to all of you who dialed in from all around the world to participate remotely for your deep and insightful questions that really added to our discussion today. I appreciate it. I know the pandemic has brought a lot of grief, and I appreciate the observations we heard tonight that can inspire hope in all of us too. We are looking forward to opening up the networking portion of our evening now through Remo, and so folks will be moving around to different tables to interact. But before we start the networking, we want to hear from just one more person tonight. I heard Miriam share her McAllister story a few weeks ago in a meeting, and it was just another one of those stories that warms your heart when you hear about how much Mac has meant to her and what she's done with her life. And I know you'll enjoy hearing from her too. So I now want to welcome Miriam Kagwa, class of 1996, a member of the Career Task Force and chair of her 25th reunion, and chief finance officer of a company called Energy BBDO. She will share her McAllister story with us now. Miriam, are you ready?
I'm ready. Good evening, everyone.
Hi.
My name is Miriam Kagwa, class of 1996. I have served on the Career Task Force for the last 3 years, and I'm also the co-chair of my class reunion next year. I am so proud to be part of the McAllister community. Listening to the conversation we just had, I am reminded as to how McAllister raises critical thinkers and how, as a community, we are always at the forefront of current issues and how we are bold and unafraid to have dialogue around those issues. I arrived at McAllister on a full scholarship in the fall of 1992. I was born and raised in a small town outside Kampala, Uganda, called Mengo, to a woman who had dropped out of school after 2nd grade. She could not even read my report card. But McAllister saw the potential in me and invested in me. They challenged me, stretched me, gave me a platform, and supported me. At McAllister then, we were demonstrating against apartheid in South Africa. I vividly recall holding hands in the middle of a February Minnesota winter, marching to the state capitol singing "We Shall Overcome." I call McAllister years my most formulative years. 4 years later, the little shy girl was walking out of McAllister, bolder, more passionate, with a voice and a determination to pursue the causes that I held and still hold dear. Almost 20 years later, McAllister did it again for my niece, Chanel, a brilliant DACA student that no other college dared to accept due to the uncertainty surrounding the DACA program then. My story and Chanel's story are not unique. They are the stories of many McAllister students and alums who have been given an opportunity of a lifetime due to the generosity of McAllister parents, alums, and well-wishers. Investing in McAllister is investing in the future. It's investing in hope. Please invest in hope for all McAllister students. We realize that not everyone can make a major gift, but everyone can make their best gift. So please look for information in the coming days on our Give from the Heart campaign that will run from December 8th to December 11th. The campaign will feature McAllister Fund's new designations of athletic support, racial equity support, and emergency aid. Now, to close tonight's event, we will close with a tradition that we hold dear, the offering of the peace prayer by our current students. Thank you.
เมื่อเฮาเริ่มออกเดินทางไปคนละสายขอให้พวกเฮาถูกหล่อเลี้ยงด้วยมิตรภาพและการเรียนรู้ที่แสนยาวนานขอให้เฮาใช้สิ่งเหล่านั้นสร้างโลกที่มีความยุติธรรมและสงบสุขยิ่งขึ้นโลกที่เต็มไปด้วยมิตรสหายและญาติพี่น้องความเคารพและเมตตาซึ่งกันและกันและความหวังเพื่ออนาคตที่ดีกว่าเก่า
अब हामी आफ्नो जिन्दगीको नयाँ यात्रामा अघि बढ्दा हाम्रो वर्षौंदेखिको मित्रता र शिक्षाबाट हामी सिन्चित हुन सकौं र यसलाई आधार बनाई अझै न्यायपूर्ण र शान्तिमय सद्भाव र सम्बन्धले गाँसिएको र एक अर्काप्रति आदर र करुणा गर्ने उज्जवल भविष्यको संसार सृजना गर्न सकौं.
As we depart along our separate roads, May we be nourished by our years of friendship and learning, and may we draw upon them to create a more just and peaceful world, a world filled with fellowship and kinship, with respect and kindness for one another, and with the hope of a better tomorrow.